Hi, my name's Gavin Jennings. I'm an orthopaedic surgeon in Bath, UK, and I specialise in the shoulder. I'd like to talk to you today about why you may have shoulder pain and what can be done about it. So the shoulder is a complicated joint, and not surprisingly, there are a number of reasons for shoulder pain. But despite this complexity, we can simplify the reasons for pain by placing them into broad groups. So the biggest of these groups involves problems with the deep tendons in the shoulder known as the rotator cuff. And about 70% of the patients in a shoulder surgeon's clinic will be in this category. The next most common area to cause issues is within the ball and socket joint itself, known as the glenohumeral joint. There's another joint that's part of the shoulder girdle, which is formed where the collarbone meets the front of the shoulder blade, and this is called the acromioclavicular or AC joint. And this can also be the root of some problems. What can make it even more tricky for a sufferer to work out where their pain's coming from is the fact that pain arising from the tendons and from the joint itself can often be felt in exactly the same place. So I'm going to explain some of the characteristics of the pain which give us a very good idea as to where that pain's actually arising from, and then talk about what we can do about it. So the first thing we need to think about is whether someone's shoulder pain is generally arising from the shoulder. Problems from the neck can also give rise to pain felt in the shoulder. This type of pain, however, is often associated with numbness or tingling, sometimes weakness down the arm, and it can sometimes be made better or worse dependent on the position of the head. Genuine shoulder pain, however, is usually felt at the upper outer part of the arm overlying the deltoid muscle. The exceptions to this are pain arising from the AC joint itself, which are often or usually felt right here, but sometimes radiating up into the neck. The tendons of the rotator cuff can be prone to developing inflammation or even tearing. This type of problem generally gives pain felt in the upper arm, particularly when the person lifts the arm up from the side. So activities such as reaching back to put a coat on, or lifting objects into a cupboard, or reaching back to get a seatbelt, for example, will often bring this pain on. Sometimes the patient will notice that as they lift their arm up, they get pain, but as they get overhead, it gets a little bit easier. And this is known as the painful arc and is pretty characteristic of problems with the rotator cuff. So treatment of the rotator cuff issue may involve physiotherapy and steroids injections initially. Physiotherapy aims to progressively strengthen the muscles of the rotator cuff and also deal with issues which may lead to ongoing problems such as poor posture. Steroid injections aim to reduce the inflammation in the tendons. So sometimes the tendons can develop tears, and in some instances these may require surgical repair to deal with the problem, and this can usually be done with a keyhole operation. The commonest problems that occur within the shoulder joint itself are frozen shoulder and arthritis, but also the shoulder joint is very mobile, and the payoff for this is that it's prone to be unstable. Frozen shoulder is a poorly understood condition where the lining of the joint becomes inflamed and then thickened. What this means for the person suffering with this condition is a progressively worsening pain and loss of movement in the shoulder. The shoulder is often extremely painful, particularly if the person reaches out suddenly or jolts the shoulder. Reaching behind the back can also become very difficult. The first treatment recommended for frozen shoulder is usually a steroid injection. In addition, physiotherapy can be helpful to reduce some of the symptoms. And if these measures fail to improve the shoulder adequately, a keyhole release procedure may be required to restore movement and reduce pain. Arthritis can occur in the shoulder just as it can in other joints such as the knee and the hip. And people with shoulder arthritis tend to suffer from pain which can be present to a degree at rest, but is usually worse with movement of the shoulder. The shoulder gets stiff and can crunch and grate as the joint surfaces get rough and irregular. Steroid injections are often effective, at least in the medium term, in improving the symptoms. If instability in the shoulder can occur at any age, but it's certainly much more common in the under 30 age group. People are often very aware of the problem, particularly, for example, if they've had a significant trauma, the shoulder's dislocated, and they have problems subsequent to that. Sometimes, however, it's much more subtle, and if the shoulder's not coming out completely but is partially slipping out, what we call a subluxation, then it may not be so obvious as to what the problem is. If instability occurs as a result of a significant injury and there is structural damage to the shoulder, then often the patient may require a surgical stabilization, and again, this can usually be done with a keyhole procedure. In other types of instability, however, where there's not actual damage to the shoulder, it may well be that physiotherapy is the route to a solution. Problems of arthritis and instability can also affect the AC joint. So as I mentioned, the pain arising from AC joint wear and tear or arthritis is felt right on the joint itself, and sometimes will radiate this up the side of the neck. Shoulder is often uncomfortable to lie on at night, and activities such as press-ups or shoulder press, which involve forcing of the joint surfaces together, will often cause pain. Again, initial treatment may involve a steroid injection, and if non-operative measures fail to give adequate relief, then again a keyhole surgery may be performed to tidy up and restore the joint space. Instability in the AC joint is usually obvious, as this results from a significant injury such as falling off a bike and landing onto the side of the shoulder. The person will have immediate and acute severe pain, and they may well notice a deformity that's developed at the end of the collarbone, where it looks as though the collarbone's sticking up. In many cases, these will settle either on their own or with physiotherapy, but in some cases, after a trial of non-operative treatment, they may require an operation to stabilise the joint. So the conditions mentioned cover about 90% of shoulder problems, and if you have shoulder pain, there's a good chance that one of these conditions is the explanation. But if you do require any further information, please don't hesitate to get in touch. Thank you.